Good afternoon, everyone, and welcome to our fourth and final webinar highlighting infection prevention in pharmacy, the road to integrated stewardship during a pandemic. This webinar is entitled Real-World Application, Leveraging Technology Investments to Mitigate COVID-19 Impacts to Clinical Care. And in this webinar, we will explore connected medication management tools utilized to visualize trends, metrics, and impacts of COVID-19 based on existing technology. These solutions can actively aid institutions in assessing changing patient conditions and treatment protocols with the goal of improving clinical care and medication stewardship, potentially yielding more positive clinical and financial outcomes. The webinar will be presented by Daniel Finley, Director of National Clinical Sales Consulting at BD. Dan is a registered pharmacist with over 30 years of related experience in the industry. He has served as a clinical consultant to BD customers for about 7 years, with a focus on product solution, design, and implementation for large healthcare systems throughout the United States. Dan earned his BS in pharmacy, as well as a master's in pharmaceutical administration from the Ohio State University. Participants, please remember you may submit questions via the chat box during the discussion, and we will reach out to you afterwards to answer them after this event. Dr. Finley, over to you.
Thank you, Calvin, and let me add my thanks for everyone for joining us today. As I think back just over a year ago, it seemed like a pandemic was the furthest thing from some of our minds, and yet here we are. It's even harder to believe that fast forwarding a year that we still have probably months of work to do and maybe continued struggles due to this pandemic situation, and the fact that it has fundamentally changed a lot of the things that we do and placed some additional demands on us that we did not have before. So looking back, I think it's easy to say that to say it's created some challenges is probably the understatement of any of us, even with some long careers. So today, we're going to focus on some of the challenges related to the pandemic as they relate to sifting through the seemingly ocean of data to arrive at information that we can use on really a daily basis, sometimes minute-to-minute basis, in order to take care of these patients, but not just that, but to maintain the care of the patients from a non-COVID-19 situation. So today, we'll focus on some of those challenges. And we'll look at those from a standpoint of, sorry, my slides need to catch up with me, of these learning objectives. So recognizing the fluctuating conditions of not only COVID-19 patients, but COVID-19 therapy, COVID-19 vaccination programs, there has been a significantly moving target throughout this entire scenario, and it really has forced us into looking at how agile can we be in reacting, and in fact maybe getting ahead of some of the demands of a pandemic. Also, I think it's taught us the importance of those data-driven insights. They are mandatory just to enable us to stay aligned with our patient care goals for all patients in our facilities, but also to add on these significant challenges of the COVID-19 pandemic. And we realize also how medication availability has continued to be a challenge. It's not as if we weren't dealing with shortages prior to the pandemic. But as a pandemic unfolds and the treatment protocols become sort of a moving target, it's placed a lot of challenges on us that we didn't have before. There's a lot of cost associated with trying to be agile, trying to be nimble. And in some cases, we know that we were a little unprepared and we needed to play a little bit of catch up. So those costs, I think the final chapter is not yet written in those. But I think that, again, this ability to collect and use data is going to not only help us get through the remainder of the pandemic and mitigate costs as much as we can, but also to look back and say, where is it that we might be able to get better and be better prepared in the future? And then finally, comparing information throughout our industry. We always, as pharmacists, I know as a pharmacy manager, it was always one of my goals to not only take good care of everything that's within my purview and my organization, but then also to take a look at that and say, I think I'm doing well. I think things are better here than they used to be. But that ability to use information and set benchmarks and really get a better appreciation for how good does good look and what does it look like if I can do even better. Okay. So as we look at the pandemic in the evolving clinical approach for treatment protocols, I think that word fluctuation is really a key word. So when we try to attack a challenge like this, I think that some of our older ways of doing things become a little bit outdated. And when I say that, I think of things like we found out that some of our sites maybe were in the same city, but were affected differently. So these questions start to arise. Which of my sites are going to be most impacted? How? When? And then how do I begin to take a look at my capacity, knowing that life may change here in this facility or across even an enterprise? I think we have just a little bit of lag. My apologies. And from there, we also can ask questions like, how do I ensure that I have a line of sight to even know how these effects are playing out? So that as these issues arise that affect me and my enterprise, how can I then set my prioritization process in motion so that I can manage both the new requirements that COVID-19 brings on board, along with the ongoing initiatives that frankly didn't go away just because of the pandemic? And as far as things I may consider, there's again a list of questions I think that cause us a little bit of pause. One of those is I now need pieces of information that frankly didn't really exist prior to the COVID-19 pandemic. So how do I add those? How do I make sure that each is a data point that I can collect? How do I collect it? And then frankly, once I do collect it, how do I go about incorporating it into my daily workflow? Then we had this relatively new phenomenon where, guess what? You need to do this, but you might have to do it from outside the walls of the hospital. So I know from our business model standpoint, we had a lot of work at home, and I know that in our area, some facilities also had to make decisions on who was going to report to work as usual. So not only do we have these new data collection points, new processes to incorporate, but we may not be actually in the four walls of the facility when we build them or even when we use them. In addition to that, we have the question of how can I prioritize my patient care. So some of the things that we heard very early on, I was heard some of our colleagues in New York talking about just the sheer magnitude of patient care that needed to be delivered. And the one thing that COVID did not provide to us that some of our other clinical challenges do is any sort of ramp up period, right? So all of a sudden we needed that sense of urgency, that sense of priority that was beyond, frankly, most of the things that have ever come up in any of our careers. So setting those priorities became very important and very difficult. From there, does my current system afford me the ability to keep up and to ramp up, speed up my process so that I can A, find the information that I need, B, have it reported in a manner that meets my clinical needs, my expectations, and frankly, how do I go about setting that up in my organization, knowing that I may not have full control over where that information might come from and how I go about getting it? And then efficiently developing the clinical alerts, the new alerts that I'm going to need in order to help my clinical staff be efficient and be effective once they have that information. And then finally, we have how do I measure progress toward my objectives? So again, this chapter is not fully written, probably won't be for some time, but I think at some point in time, probably beginning about now, we also do need to be able to look back and evaluate where we saw spikes, how we reacted to those, what the patient outcomes were during and after those spikes. So again, measuring that progress and knowing what the overall effectiveness of our clinical programs has been through the pandemic and needs to be in the future. So as we go through that, obviously we're going to identify some gaps. And among those gaps, one of them is speed, right? So that ability to rapidly intervene, not if patient conditions change, really when they change, as they change. So we had not only different presentations of patients coming in through our emergency departments, we had a lot of confusion, It was a novel virus. Obviously, the word novel means that we have not seen it before. So that meant that we needed a different approach. We're very used to working with some pressure. We're very used to words like soon or as soon as possible. What COVID-19 did to us is set in motion the term now, right? So that's actually when we need the information. So that speed to impact is a very critical thing, and a gap that we've heard over and over expressed by clinicians. We have those new information sources. There's new lab testing, and either new drugs in some cases, or unexpected or new uses of existing drugs, right? So to pull those in and make sure that we have an accounting of how they're being used, on whom they're being used, matching them up with our protocols, and all of that with a backdrop of changing patient condition, changing protocols, right? So that ability to be nimble continued to come into play. And from there, increasing visibility. I know we heard from a number of larger IDNs that they had a disparate, I guess, set of expectations or experiences throughout the pandemic. So that ability to have that visibility, when you think about things like your drug supply, you may find that it's available in one location, not in another. How do I manage that supply? Also on the people side of things, when the pandemic hit, obviously we as healthcare professionals certainly did not begin immune to COVID-19. So there was also the aspect of how do I manage my clinical staff and make sure that I have the capabilities where and when I need them. Okay. And then finally, accuracy, that accurate monitoring and measuring of success. How do we know what's working well? So again, that ability to report both on an ad hoc basis, what's going on right now, but also that ability to look at that over time and determine the impact of the clinical programs that we're able to put into place. So when we think about information technology and the impact throughout the pandemic, a couple of key things come to mind. Those new tests, different uses of drugs, different combinations of variables that we need to look at in order to assess, take action, reassess. Those all probably required some sort of mapping, whether it was adding new tests to systems and having them propagate throughout. The medications themselves, do we have the drugs mapped accordingly, and can we combine now the results of lab tests? And the key element here is can you do it? The second key element is how fast can you do it? And then the other thing that COVID-19 threw at us is, can you do that today? And maybe only to find out that tomorrow or next week you need a whole different set of monitors, or you need to change something that you're doing. So as you consider that and the impact of that on your information technology, you need to have a solution that is as nimble as the situation calls for. So once you get that alignment with IT, who, by the way, in every place I've ever worked, they're nothing short of miraculous at times in what they're capable of helping us with, but they have the same limitations in terms of bandwidth and capabilities that we do, frankly. And then finally, verification and validation that the data in the systems is correct. So again, as new information comes in, making sure that we accurately describe it, accurately map it, and that the reports that we're getting from our systems are actually the information that we need to take care of those patients. So that importance of that visibility and data-driven insights is kind of where all this heads when you think about the operational day-to-day impact. We as pharmacists think a lot in terms of making sure drugs are available, making sure that they're being used appropriately, and that tends to be in large part what our focus is. But also understanding what therapies are and are not working. But then we have colleagues in the facility also focused on the patient variability and monitoring policy and compliance. So beyond the drugs, we also had to think about things like, do we have enough isolation available in the facility? How do we manage the clinical elements of patient care and make sure that we not only take care of them from a pharmacologic standpoint, but also from a good infection control practice standpoint? And then, of course, superimposed on that, taking care of ourselves, right? Making sure that to the extent possible that we're following those guidelines as they evolve, and we can maintain compliance and help keep everybody as safe as possible. Now, medication availability, I think that anybody who spent time in a pharmacy this year probably had some nervous moments because we had recommendations early in the pandemic that ended up changing throughout the pandemic. And as those changes took place and we started settling on a more, hate to use the term routine course of therapy for COVID-19, but eventually it did sort of settle into kind of an expected course, right? Or expected treatment course at least. So what we needed in order to stay ahead of that and continue to need is this ability to have appropriate alerting so that when we've identified what our treatment protocols are or need to be able to know almost immediately what patients are receiving the therapy that they need, but also this concept of connective medication management strategy to say we're learning every day from our clinical monitoring what the needs are. Now we need also that capability to be able to see across our organization what our supplies are, which drug supplies are we worried about, making sure that we always have the products available. But from there, we needed the ability to send our clinical staff out armed with information that would help guide them. You know, I think back to the time that used to be required just to prepare for rounds every day. Now, granted, my career goes back a long time before many of the clinical programs. I should say clinical data sources existed. So a lot of it was on us. But I think that still exists in some locations. And even in organizations, your organization, for example, may have excellent availability of clinical data. So you recognize the importance of sending that clinical pharmacist out without needing to do 2 hours of data collection, combining lab reports with the drug regimen and preparing for those rounds. So the rounding list concept has become even more important. Compliance checklists. Sure, you use all this information to make decisions, but those decisions are only as good as your ability to follow and track them. So making sure that you have a way for your clinical staff to always be presented with the current wishes or desired state in terms of how they clinically care for those patients, but also the ability to demonstrate that they're doing so. And of course, that promotes that awareness throughout the whole organization. So switching gears just a little bit. So I think, you know, the problem statement is pretty clear. And I think that everybody on this call has probably lived through at least some of that pain and in large measure may continue to do so. So when we start thinking about how we might attack that, we start kind of with the basic building blocks of that clinical monitoring. And one of those that I'm showing on the screen here comes through the Infection Advisor. A view of Infection Advisor, where we start to combine the different data elements in order to begin to generate that picture of how do we take this information and then apply it to our clinical practice. So this may be a little bit small on your screen, but for example, a positive SARS-CoV-2 test, right? So combining that then with some of our drug therapies, whether it be remdesivir, or in some cases azithromycin, if you wanted to track the bacterial infections secondary to COVID infection. But to begin to build those blocks. So obviously what's required here, the data need to be available, but what's really important is that this dashboard view is something that you'll want to have control over, right? So the important thing about that is that you have now the ability, you decide what it is that you need to measure, of course, based upon your collaboration with others in the organization. And your speed to impact is increased because it's a matter of building these simple lists of monitors that you want to incorporate. From that, you can begin to combine those data into various tools. One tool, for example, just showing an individual record from a rounding list, where now we can bring together current medication use, positive microbiologic result, abnormal labs. So the first step was deciding what it is you want to monitor. Then you build it into the view that is, this would be the equivalent of hours worth of work from the early part of my career. And again, I know some of you have processes in place that that make it a little better than what I had it in the early days, but this is kind of an important element that you chose what you wanted to monitor. You chose what you bring into the rounding list. From there, so switching gears just a little bit, so you have the individual patient care requirements, those your rounding list, your hit list, if you will. But at some point in time, especially during a scenario like the COVID-19 pandemic, you may have as much as daily or twice a day meetings where the main question is, how are we doing? What are we seeing? So along with those individual points of impact that you can have on individual patient care, we can look at things in the aggregate. So also very important. So what you're seeing on your screen now is a dashboard view that is part of our drug stewardship. Won't belabor every point on this screen. It may be a little hard to read, but it gives you now that ability to say, here are the trends that we are seeing in treatment here in this facility or among a group of facilities. So you have that flexibility to look at it kind of an enterprise level, right down to the individual facility level, and even as you can drill down as far as into individual parts of the hospital. So if you look here, a couple of things that I see, the drugs by class. So obviously we learned early on there were some drugs that we were sure we did want to use for COVID-19 patients, but we all recall there was also a drug that we really did not want to see used for COVID-19 patients. So, and both could have importance to you, right? If you want to propagate the use of the agents that match your treatment protocol, but also keep an eye on those that you would really prefer to keep out of the treatment protocol. From there, we go to a different view here. So this is more related to the patients. So what kinds of trends might be helpful to you in identifying where to spend your time, your resources, and maybe even head off problems as they occur or before they occur. So this is where you can get an idea. Again, you're pulling in the information relative to COVID-19 testing. So you have your positive, negative results. Obviously, from that, you can get your positivity rates. But what's interesting here is that you have the ability then to look at those on a segmented basis, so that you can see over here by age. So you can see, does our pattern match what we thought it was going to, or do we have something going on that maybe deserves a little bit more attention? Then also by location. So remember, pharmacy is a critically important piece in the treatment realm, but we also know that good infection control practices are another critically important factor. So location-based information, where are we seeing the patients? Are we doing well in the context of keeping the COVID-19 positive patients isolated, or are we seeing some hotspots maybe even within our facility? So good information to be able to have at your fingertips in order to make those assessments. Okay. Now, another really important factor here is we know that now that we can make decisions on what it is we want to monitor, we know that we can place that information in front of our healthcare professionals so they can actually, in the physical sense, go do the intervention. We also know that at some point in time, the documentation resulting from that is critically important. So creating the new patient, creating ways of documentation needs to be built right in to that system, so that without too much switching back and forth between systems, you have the ability to create patient documentation forms, as well as to preview existing patient documentation. So now you have a good communication pathway to say, number one, this was taken care of, this was what was done, so that you have that audit trail for both internal use to be able to pass information on to each other. But also remember, of course, we have our external reports that are required in order to demonstrate that our care practices to outside organizations. Okay. Now from there, we're going to take a little bit of a turn here. So, as we work our way through the elements of this monitoring system, we focus a little bit on cost. So some of this is very straightforward. We know that there are direct costs associated with the drugs themselves, but you also, in a lot of cases, need to define cost, perhaps in different measures. So besides the actual dollars associated with things, how about length of stay? Location. You could have differences by locations within your broader organization or even within one facility, so that we can get an assessment by attaching our cost definition to the monitoring process. That way, we can, whether it's in real time or later on, take a look at the impact of the things that we did to try to mitigate those impacts. Okay. This is an example of what one of those dashboards may look like. This one was taken obviously from Health Site Infection Advisor with MedMind Insights. So again, pulling together it's in this case admission data. Now this one's a little bit off of the COVID-19 um, structure of this discussion, but healthcare acquired infections is really the focus of this one. So what you'll have is the ability to associate different types of cost and to pull those items together so that you can get these dashboard views. It kind of falls into that category of you can't manage what you can't measure. So if we now have the ability to measure and report and put information in front of ourselves at the point of attack and also in this more aggregate form, now we have the ability to measure those things and therefore do what we can to manage those things. So, at some point in time, we're pretty sure that we will be post COVID-19 pandemic. And we know that there's going to be a return to the pre-COVID state. We're not there yet, obviously, but I always like to point out when we talk about COVID-19 that yes, it is one of the most important things we have to deal with today, but it doesn't diminish the importance of what we've been doing over time. So, again, it's an and conversation, not an or conversation. You had to take care of COVID-19 and the rest of the things that you already were focused on. So we need to maintain that laser focus on our efforts to improve everything. Peer learning, we think, is going to be crucial. Leveraging information not only from your organization, but potentially from other organizations might be a big advantage moving forward. Okay, and that brings us to benchmarking. So when we think about benchmarking, things are complicated in a number of your organizations. For example, acquisitions take place. Changes happen with different hospitals coming together. They may or may not be homogenous in terms of their EMRs, or if they use the same one, maybe not the same instance. So a process that's going to be successful is going to have that ability to take that sometimes disparate data and have a normalization process that brings it together so that when you do your benchmarking, you've got that overused term, apples to apples comparison, and that capability of actually measuring things all the same way across otherwise disparate data. Also gives you that ability to standardize so that when you are creating your reports, presenting your reports, that you have one way talking about the problem, the solution, and the outcome, even though different criteria may have gone into selecting those points of measure. Okay. Lack of visibility into lessons learned has been a problem in the past. I think benchmarking is one of the ways that we might be able to make an impact on that. So again, when you consider how you structure your clinical surveillance, your clinical activities, you can keep in mind that as more and more data are available and are normalized and reportable in a common format, the ability to use that to say, how are we really doing, is going to improve. Okay, this screen shows an example of, this is again from Clinical Advisor, Health Site Clinical Advisor, where again, you are in charge, you choose what it is that you believe is important, and very quickly and easily create these monitors where you can now benchmark. And in this case, we have 4 hospitals shown here. We've selected different types of antimicrobials that we want to monitor and benchmark throughout this organization. And you can see that we're able to monitor days of therapy as they relate to days at risk. So that's your DOT and DAR. And as a consequence of that, we have now it's an analytic, right? It's no longer just numbers. It's no longer just saying this is how much third generation cephalosporin we used, but we can relate it back to days of days at risk. And now, when you look facility to facility or within your own facility, you have a basis of comparison that might actually be more helpful to you. Okay, and do notice too that it's reportable over time. So again, that's the other important element here is in order to see where you need to go next, it's very important to know where you've been and where you are. Okay. Another way to display useful information. This now is an example of antimicrobial usage over a period of time. This is benchmarked now facility to facility. So the purple line is representative of us, of where we are. The other lines are representative of other, in this case, national, regional benchmarks. So again, as the data set grows, this ability to find out, okay, we think we're doing well. We've noticed some positive changes here, but how are we doing as compared to what others might be doing? I know throughout my career, that is always a question that comes up is how do I best benchmark against others? Okay. So as we sort of wind up here and give an opportunity for maybe some chat questions, the important elements here, I think, data visualization, of course, the ability to see. If you can't measure it, you can't manage it. And the ability to prioritize those clinical efforts, obviously mission critical. And what I would add to that, just from my own experience, is that speed to impact. So when you become responsible for making a change in your organization, or you make yourself responsible for making a change, there is that need to do it in an amount of time and at a cost that is appropriate. So the mission is clear. The tools chosen can make that mission easier or much more difficult. And that rapid adaptation is absolutely essential. That ability to keep up with a changing environment, and also to maybe even look ahead. We probably can no longer sit back and be a little bit incredulous about the possibility of a pandemic. This past year, I think, has taught us that. So the question now might become, what can we learn from our experiences with COVID-19 over the past year? And what did that show us about our ability to more quickly adapt if and when another pandemic or any other unforeseen circumstances present themselves? Okay. Again, thank you so much for your kind attention today. I know that Calvin may have a few closing remarks, so I'll pass it back to you, Calvin.
Thank you, Dan. Thank you for a very informative presentation, not just clinical, but your experience in operational workflow and administrative pain points are well appreciated. We unfortunately don't have any time left for questions. Those of you who submitted questions, we will reach out to you afterwards and answer them after this event. Thank you so much for joining us, whether it was this webinar or our prior 3. All sessions from today will be available on bd.com/altogethernow for on-demand viewing. One final reminder, the spring event in the BD virtual event series, Altogether Now, Driving Patient-Centered Care Through Connectivity, will take place again in May. And the topic will be regarding transitioning workflows from using reports to operationalizing analytics. Please mark your calendars. And again, it's visit bd.com/altogethernow for further information. I want to thank you all for attending today's webinar series, and please stay safe during this pandemic. Thank you.